Throughout the year, we have been introduced to a number of different pieces of clinical equipment. One of these pieces of clinical equipment is known as transcutaneous electrical nerve stimulation, also known as TENS. The effectiveness of TENS and its clinical evidence base for its inclusion in the current healthcare system is under debate. I looked into a number of different studies to further determine the evidence surrounding TENS. In the study conducted by Sarah et al. 2005, the objective was to determine how effective TENS was in reducing chronic lower back pain, and this was achieved through a systematic review. In two randomised controlled trials, 175 patients were reviewed. In one of the RCT groups, TENS produced vastly greater pain relief than that of the placebo. However, in the other RCT group, there was no statistically significant differences between the control and the treatment groups. The study concluded by stating that there is little and inconsistent evidence supporting the efficacy of TENS. Future recommendations were that research should be concerned with addressing the long-term use of TENS and its effectiveness in pain management. Comparatively, in the study conducted by Chabal in 1998, treatment outcomes in long-term users of TENS sufferers from chronic back pain was assessed. A large sample size of 376 patients was used in order to determine the effects. These patients were interviewed via telephone and an independent research firm. The survey was assessed over a 6-month period where the data was subjected to a paired t-test analysis. The results of the study were that there were significant reductions in pain in long-term sufferers, helping to put less strain on occupational therapists and physiotherapists resultingly. Future recommendations made were to encourage these practitioners to incorporate this treatment method as a means of reducing pressure on clinicians whilst gaining effective pain relief for the patient. This is also an effective method of pain relief at home and in the office for work within reason. TENS is a treatment method that I am yet to observe on placement. However, it's clear from these studies that the benefits are and the evidence behind it are inconsistent, and there are inconsistent signs that it is beneficial for pain relief in chronic sufferers. So future recommendations would be to further study in this area and the long-term effects of chronic pain relief.